Welcome, everyone. Hopefully you've made it over from the previous session now, or got a chance to, refresh your coffee at home or at work, wherever you are. We are here using the ACS to measure income and employment. And because this session, we don't have a lot of time, I'm just going to jump right in. You can find bios about the speakers on the session page. I will quickly note, please use the Q&A. I will be monitoring that to share questions with the speakers and to send them out so everyone can see them. And then we'll read them for the speakers at the Q&A at the end of the session. So with that, I think I'm just gonna, if I think of anything else, I'll get it in between speakers. So we will go ahead and start with David Gibson. Thank you.
Thank you, Kathy. Yell if you can't hear or see me. But thank you for the Planning Committee and for the Census Bureau for hosting another one of these events. I've actually been happy to be at all 5 of them so far, and keep on going. Let's share my screen. All right. As some of you may know, my background in using the ACS is quite different from almost all of you. My company, Vocational Economics, Inc., specializes in giving testimony in civil cases in matters concerning loss of lifetime earnings due to death or disability. We use the ACS PUMS data to help us quantify how earnings will change over time and what the probabilities of employment are for a person at a given age based upon their level of education, gender, other factors. Disability plays a heavy role in there too. But this particular analysis focuses on the fact that we also rely upon various data such as the Bureau of Labor Statistics indices on how wages or compensation grow. Those indices are based upon all levels of education in the population. And we occasionally get criticism or questions saying, well, how can you rely upon that when earnings grow differently depending upon what the level of education is? And the inference is that lowest levels of education grow more slowly than the higher levels of education. So what I am attempting to do in this presentation is to measure that using the data that's available from the ACS. I use, again, the ACS PUMS data for this. For this particular study, I probably could have used summary data, but since I use the PUMS data for everything else, I did it here again. I'm going back to the first year of the full implementation of the ACS, 2005. So I have 15 years of data that I'm studying here. The education levels that we'll see for most of the presentation are collapsed. I actually looked at several more levels of education than you'll see here, as you'll see in one of my slides, but I broke them down into 3 essentially equal proportions of the population. At the low end, everybody that has a high school diploma or less than that. At the high end, everybody who has a bachelor's degree or greater. And then everybody in the middle, which would be people who have some college, but it's less than a baccalaureate degree. I also considered other factors in the modeling or the observations I made, such as gender, whether the person was full-time year-round or all workers, whether I looked only at wages or whether I also included the earnings from self-employment, and age. Out of these, the gender, full-time year-round, wage versus self-employed didn't make that much of a difference in what I'm about to present. So what you're going to see is data for both genders combined, persons working full-time year-round, and all compensation. But I will look at some differences by age. As a backdrop to all these things, need to recognize something that's a bit surprising to me when I graph it out. But the change of the education distribution has been rather rapid and dramatic over this 15 years. What you'll see here is the blue bars indicate that the percentage of the population with a high school diploma or less has dropped quite a bit from 38% in 2005 to 32% in 2019. And obviously this is for full-time year-round wage earners, not necessarily the population as a whole. For persons with a baccalaureate or above, similar change, but in the reverse direction, going from 32% in 2005 to 39% in 2019. So obviously with the changing distribution going more towards higher earning persons with a baccalaureate or more, the overall wage growth taken as a group from one year to another could be distorted by that. I adjusted for that in anything that I do that uses the average rate of growth for the population as a whole. The blue line up here sees the overall rate of growth from any given year up until 2019. So the cumulative impact. So for example, that cumulative impact being about 35% increase from 2005 until 2019. However, if I take each of the individual year's earnings and reweight them by the distribution that exists in 2019, I come up with a different level of earnings and therefore a different level of wage growth that's quite a bit lower. That you'll see here, dropping it from 35% to about 27% cumulatively from 2005 going forward. And here you might want to note, by doing so, during the recessionary period, 2007 to 2010, those earnings are pretty flat. And that recessionary period will pop up again and again in the slides that we'll see later on. Over time, of course, they're going to come very close to each other. My initial attack at this looked at a lot of different education levels that you'll see listed down here. And of course, it gets a little noisy and a little cluttered when you do so. But two things at least stand out. One is this blue line up here, which is for people with less than a high school diploma, are consistently above the rest of the crowd, which is the exact opposite of what some of the detractors had made when they criticized use of the average wage growth from BLS. And then down at the very bottom would be persons with an associate degree. I then collapsed these, as I indicated before, into three different levels of education, which we'll see here. And once I do that, fairly consistently, what you'll see is that the highest level of earnings growth cumulatively has been for persons with a high school diploma or less, while the lowest level of earnings growth has been for those that have some college education, but less than a baccalaureate. While two lines are merged here because they're almost identical. And that is, the green line is for baccalaureate or more. The dashed line is that reweighted average growth for all the years. So kind of surprisingly, college less than baccalaureate is very consistently below the earnings for all others. Breaking this out a little bit, obviously, when I'm doing a cumulative growth that we were just looking at, excuse me, the cumulative impact could be distorted by, say, a change in 2018 could have a heavy impact on all the years before that. So in this slide, what I'm looking at is how the annual change varies from the average change for a given level of education. And here you'll see the blue bars, first of all, for high school or less, obviously ups and downs. The biggest years of variance has to do with the recessionary years, 2008 and then 2009, and they're offsetting. And pretty much that's what you're going to see, a lot of offsetting ups and downs over time. However, this last several years, last 4 to 5 years, have been fairly consistently above average. And that's going to weigh backwards in that cumulative impact that we saw on the prior slide. So a lot of the cumulative impact for high school is really coming from these last 5 years. Now, I definitely can't conclude that that's a trend that will continue in the future. I could just observe that that's really what's causing a lot of the variance that we saw earlier. Similarly, if I do it for college, less than baccalaureate, here, even though they do have big swings during the recession, it's been pretty consistently below average. So once again, that leads to the impact, but I can't attribute it to one period of time. It's pretty consistent over time that they're below average. While baccalaureate or more, you'll see ups and downs that cancel out, which is why they pretty much match the average over time. Breaking it out by age, I find that yes, there is a distinction by looking at the younger half of the population versus the older half, where the population for me right is 25 to 64, but the blue line being those 25 to 44, the 45 to 64 being the top. So there is something there. If I combine age and education, I find that high school is pretty similar. The age doesn't make that much of an impact there. But for both college less than baccalaureate and for baccalaureate, for the recent years, you find that they're very close, but the cumulative impact from the recessionary period carrying forward a couple years is where the big changes have been. If I redo my earlier graphs showing the levels of education by age, you see that the 25 to 44 pretty much mirrors what the overall population was, showing that that's the real driving fact behind the discrepancies, the big discrepancies you see here for college less than baccalaureate and for high school or less. While looking at the 45 to 64, they're much closer together. They're still obviously college less than baccalaureate is still an outlier in the earlier years, but more recent years, they follow pretty much in step with the average. Looking at that 25 to 64 group a little bit more on the annual variances, you'll see that the high school or less, this is where the distinction comes for that we saw for the population as a whole is from this age group. Similarly for college less than baccalaureate and for baccalaureate or more. Excuse me. I also attempted to look at it geographically, but not with a whole lot of results there. I looked only at the top 5 consolidated statistical areas, so very large areas for New York, Los Angeles, Chicago, DC, and San Francisco. And here, because I am using PUMS data to classify that, I do have changing geographies in the data that was available starting in 2012 going to 2019 based upon the 2010 census definition that took place then. So that's all I'm looking at for this particular foray. There I noted that for Los Angeles, Chicago, and New York, the observations were very similar to what I saw for the population as a whole. For San Francisco, I found that they're similar, but with the exception that high school and baccalaureate have very little divergence. It's just the lower levels that have the lower levels of growth. And for DC, there's really very little differences except in the early recession years. So Los Angeles being the most like what we saw for the population as a whole, looks very similar to the slides we saw before. New York being also similar, but the least, getting closer to a convergence. Overall, I can't really say I have any conclusions that there's any geographic trends that would indicate anything different from what the national trends are that we saw earlier. All said, I can't conclude that the disparity that the questionnaires that I have in depositions and trials has any merit, that there is anything that's different from a national average. The results are contradicted by the age of the respondents. The impact of education is inconsistent, being that the lowest level of education has the highest growth, the next lowest has the lowest growth, and then the highest is right in between. There's no consistency there. It is a short time period. We're only looking at 15 years. What's going to happen in a longer time frame is unknown, obviously. And then also there's a big impact in what we're looking at from the recession of 2007. Then further, I would note that whatever variances we have are lower in the more recent years. They aren't as significant as some of the others, especially at that middle education level, which is the most consistent low variance from the average. And then finally, obviously 2020 is a big question mark on how that's going to impact this. We saw the recessionary impact hitting 2007 to 2009 pretty significantly. How it will come to play in 2020 is yet to be seen. That said, I'll leave you with my contact information and open for any questions you might have.
All right, I'm back. Sorry, I was having some clunky mouse there. Thank you, David. Please get questions in the Q&A box, and I think we're going to take those all at the end. So I will get the Q&A questions to make sure David can see those, and while we turn things over to Zach Fussfeld, who's at the Drexel University School of Public Health. Thank you.
Thank you for that introduction. Did
I get that right?
Yeah, you did. That's perfect.
Oh, good. Okay.
Yeah. Not
everybody. Get off now.
Give me 1 second. Here we go. Let's get into slideshow mode. How does this look? Everybody can see? I'm going to assume.
Yes, looks good to me.
Okay, great. So it is officially afternoon, so good afternoon, and thanks for having me today. My name is Zach Fussfeld, and I'm a second-year epidemiology PhD student at the Drexel High School of Public Health. And so today I'm going to be talking to you about using ACS PUMS data to generate robust estimates to visualize essential worker disparities for use in a data dashboard. So just to provide you with a little bit of background before we dive in, this project was undertaken as part of the West Philly Promise neighborhood, which is a 5-year place-based multi-sectorial initiative funded by the Department of Education, which is designed to create a comprehensive cradle-to-career continuum of support for families and children who live or attend school in the Promise neighborhood. And so as a part of the data and research core within the Promise neighborhood, whose central goal is to direct all of the data and research components within the Promise neighborhood, we applied to and were awarded a Drexel Rapid Response Grant to build an interactive dashboard showing neighborhood level vulnerability to the health, social, and economic impacts of the pandemic. And since we were interested in mapping and describing areas and populations that might be most likely to experience the negative economic, health, and social impacts of COVID, we developed 3 dashboards. The first one focused on social vulnerability of people living in Philadelphia using the CDC Social Vulnerability Index, looking at certain indicators of socioeconomic status, household condition, and housing status, to name a few. The second dashboard contains a few additional indicators looking at a few COVID-related vulnerabilities, particularly housing cost burden and eviction rate, as well as certain health risk factors, for example, diabetes, asthma, and high blood pressure. And then finally, our third dashboard, which will be the topic of today's talk, was interested in exploring disparities as related to essential worker status, particularly focusing on where essential workers live, as well as disparities in race and pay of essential workers. And so it was the goal and hope of this dashboard that the easily accessible data would facilitate policy decision-making, for example, through identification of areas of the city that may have a greater need for relief, resources, and funding, as well as in assisting in grant applications, as well as community efforts to build coalitions and for the purpose of advocacy and to raise general awareness of community needs. And so, as I mentioned previously, part of our work funded by the RAPID grant was interested in characterizing essential workers in Philadelphia. And so for the remainder of the talk, I'm primarily going to be talking about the methodological approach we took to get this data. And so given the importance of generating accurate information, especially in the context of COVID for both community and policy action, we decided at the outset that we needed to ensure that we had sufficient confidence in our estimates. And so to do this, we ultimately used the ACS replicate weights and jackknife resampling to generate accurate standard errors and confidence intervals, which I'll discuss further shortly. So upon the basis, additionally, it was important for us to make sure that we were looking at the right workers who'd be considered essential in Philadelphia. And so to do this was actually harder than we had expected. We had to rely on data from the city of Philadelphia, which was surprisingly difficult to track down, as well as important information that was derived from the work of others who were interested in these same questions, but in different settings, particularly some work from Boston Indicators, which is a research center at the Boston Foundation, which is working to create indicators to help improve health and health equity in Boston. And so upon the basis of this previous work and taking into account the differences in the way Philadelphia had established regulations around essential worker designation, we devised the following essential worker categories, which included food service, hospital workers, outpatient healthcare, food retail, trucking, warehouse, and postal service, nursing home, residential care, facility services, social assistance, transit, and other manufacturing. So just as a brief overview, information on industry, race, ethnicity, pay, as well as where essential workers lived ultimately ended up in some form of the dashboard. But I'm only going to be talking about industry, race, ethnicity, and pay, as this was the only data from this dashboard, which came from the ACS PUMS data. So how do we decide what specific data to include on the dashboard? Now, because the PUMS dataset uses a proportionally representative sample with a fairly small n, and particularly due to concerns over low overall population of certain socio-demographic subpopulations in Philadelphia within essential workers and within certain income groups, we were interested in generating robust standard errors to improve the accuracy of our errors and confidence intervals and to give us a better sense of the certainty or uncertainty in our point estimates, and to ensure that we weren't reporting estimates that had extreme levels of uncertainty. And so as recommended by IPUMS USA, we utilized jackknife resampling with the ACS PUMS replicate weights to generate replicate standard errors using SAS 9.4. And so essentially, it's in the equation down here below. What jackknife resampling does is it computes estimates using a leave one out resampling strategy and averages estimates across the replicate weights, in this case, the 80 ACS replicate weights. And like I said, you can see the manual calculation by hand in the bottom. I, of course, did not do that. I used SAS to do the math for me. So here we have two examples. For the sake of time, I'm not going to go over all of the essential worker categories because that would be like a 45-minute presentation. But we have two examples here comparing the proportion of workforce by racial category in outpatient healthcare workers and food retail workers. And so as you can see, for outpatient healthcare workers, Black people make up approximately 48% of the workforce, with a 95% confidence interval from about 45 to 51, versus white workers who made up approximately 36% of the workforce, with a confidence interval from 32 to about 38. And you can see from the non-overlapping confidence intervals, there's the suggestion that outpatient healthcare workers are more likely to be Black than white. But on the other hand, in food retail, the point estimates are closer together. The confidence intervals don't overlap, do overlap significantly, which suggests there might not be any substantial difference in prevalence across racial categories in that particular group. And while it's not shown here, we can also compare these prevalences to the racial ethnic distribution in the city of Philadelphia, which could be instructive on if the burden is higher in general. And so for reference, 41% of Philadelphia is Black, 40% is white, 7% of the population is Asian, and 15% is Hispanic. And so you might notice, for instance, that for outpatient healthcare workers, it seems that Black people are overrepresented with nearly 50% of the workforce being made up by Black individuals, compared to only 41% in the general population in Philadelphia. Whereas white people, Asian people, and Hispanic people are all slightly underrepresented. In food retail, on the other hand, it actually seems that Asians and Hispanics are slightly overrepresented, while white and Black populations are slightly underrepresented. And so when using jackknife estimation to look at the proportion of the workforce that each race contributes to each essential worker category, we found that even with relatively small sample sizes, such as in certain categories among Asian and Hispanic workers, we were still able to establish relatively tight confidence intervals, and certainly tight enough that it felt appropriate to include all in comparing across populations. So what does it look like when we are interested in stratifying by race and comparing the distribution of workers by their income level? We can look to an instructive example using our categorization of trucking, warehouse, and postal workers. And so in this slide, you can see the individual breakdown for white workers on the left and Black workers on the right in this category. And the confidence intervals just visually look pretty comparable. For white workers making less than $10 an hour, for example, we get an estimate of 36% with a 95% confidence interval from about 28 to about 44. And for Black workers in the same income category, we get an estimate of 44% with a 95% confidence interval of 36%-ish to about 51%. And so clearly the confidence intervals are wider than when we didn't take into account income, but at least across Black and white race ethnicities are still tight enough that we are not particularly concerned with the accuracy of our estimates. So what does it look like when we look at Asian and Hispanic workers broken down by income category? It was clear to us that the confidence intervals were significantly wider. And so for Hispanic truckers making less than $10 an hour, we got an estimate of about 37%, with a 95% confidence interval from about 24 to about 50%. And for Asian workers making less than $10 an hour, we got an estimate of about 48% with a confidence interval 95% spanning from 28 to 67%. And so given the width of those confidence intervals, we didn't feel that we didn't feel strongly about the accuracy of our estimates. And so in any case, they compared fairly unfavorably to white workers who had a confidence interval range that was only about from overall 16% from the low confidence interval to the high confidence interval, and for Black workers in the same category whose confidence interval range was about 15%. So at the very least, we did not want to include these in the dashboard to avoid any inappropriate comparisons or inferences being drawn across racial categories. And I'll just note that these trends were similar across all worker categories with some variation in estimate numbers, but with CI ranges noticeably wider for Asian and Hispanic workers in all categories as compared to either Black or white workers, which were typically comparable. So what did we end up putting on the dashboard? Here you can see a snapshot of what some of the data included actually looks like on the dashboard. And so in this example, we're looking at food service workers in Philadelphia by race and ethnicity. And so because we saw generally tight confidence intervals across all worker categories when only considering race, excluding different pay categories, we felt that it was appropriate to include all racial categories. But to avoid unnecessary complexity, we didn't include the confidence intervals. Just we found that it was too noisy when they were included in the dashboard. And so in the dashboard, the top half is devoted to breaking down this essential worker category just by race and ethnicity. And you can click through and view the different categories by percent. And if you wanted, you could also toggle to the count, which gives you a weighted estimate of the number of workers in each racial category in each essential worker category as well. On the other hand, for comparing the proportion of worker pay categories by race, we ultimately decided to exclude Asian and Hispanic workers from the dashboard display due to the relative lack of confidence in our estimates. And so as a result, our estimates only compare across Black and white racial subgroups, and we include a disclaimer in the bottom, which just explains that as a result of small sample sizes, we didn't feel it was appropriate to include these estimates alongside other racial categories to avoid any potential inappropriate comparisons being drawn. And again, we didn't include confidence intervals here for the same reason as before. It would just end up being too noisy. And so, in concluding, just in light of the COVID-19 crisis and the need for rapid response, both at a community level and at a policy level, it's clear that the capacity to generate information that's accurate and can be disseminated back to our communities and to policymakers has essentially become a requirement. Because these issues are of an important nature that can impact policies and organizational decisions that affect the livelihoods and health of people living in the city and across the country, it's of critical importance that estimates that we as researchers generate are accurate and that we have faith in the data that we are displaying. So it's something of a subjective decision whether to include or not include, but sometimes we found that when it turns out data estimates are not able to be precisely estimated to a level that we want to have when we're displaying this data, a decision does need to be made whether or not the potential for misinterpretation can be problematic. And so we decided in this case that it would actually be better to not report the estimates at all, and to simply explain that we didn't have the ability to accurately estimate for those subgroups. Finally, it's also important that when you're using small representative subsamples, for example, when you're looking at essential worker categories, which are already necessarily small since it's only a subset of the workforce, and then going even further into, say, you want to look at income or anything else that's going to divide it up into at least two or more categories. We really do need a way to generate robust standard errors. And so there are a number of ways this can be done. But given that IPOMS USA does have guidance for using the jackknife replicate sampling strategy, we adopted this method and we're able to get robust errors for our estimates. And it really helped us make some decisions on what to actually put on the dashboard. And so I think I would recommend to avoid a false sense of security in the accuracy of estimates. I would suggest using some kind of robust estimation, whether it's jackknife resampling, bootstrap resampling, or some other robust estimation method, which there are many. Finally, I'd like to thank everybody who contributed to this work. Danny Galpern, particularly, without whom this wouldn't be possible at all, thanks to his expertise with Tableau. He is a Tableau wizard. And also in conceptualizing the dashboard to begin with, as well as the rest of the data indicators team within the Data and Research Core and our PIs, Amy Carol Scott and Felice LeShervin. And if you'd like, the slides are available in my uploads and you can use the link up top, or you can just type it in. We made it a bit.ly so it wouldn't be that irritating to type in manually to access the dashboard, which has much more than just essential worker data, as I mentioned. I think that's all for today. I just want to mention that we're supported by the Drexel Rapid COVID Response Grant and the Department of Education grant that I mentioned earlier. And thanks again for having me here to talk to you.
Great, thank you so much, Zach. I'm gonna jump right in and get David a couple questions, and then I'm gonna get through the moderation. There's a few for you as well, and we'll see how many we can cover. I made a joke in the last session about doing time zone math. I've already confused myself, but we do only have 5 minutes left, not an hour and 5 minutes. All right, so the first question for David, does this data change in any significant way if you look at median wage and growth instead of average?
I mean, significance is the margin of errors would go, yes, you're probably going to have some significance, but the overall conclusions are very similar. So, I mean, I didn't get into margins of errors and everything here because I'm dealing with such huge sample sizes for the 3 levels of education that I focus on, that the margin of error is going to be extremely small. But, oh, there we go. Now I can show my screen. But that said, when I did look at means versus medians, the overall conclusions and overall trends were very consistent.
Great. I just sent Zach a couple of the questions, so I'm going to have David take one more, and then we'll go to those 2 for Zach. How does that sound?
Okay.
All right. All right. I am going to move on to do populations that are high school or less that have attended a trade school factor into earning potentials?
That's a good question. I didn't look at trade school. for this at all. There is, I believe, some ability to do so within the ACS. I know there is within the CPS. I don't recall whether that's possible with the ACS. I did look at trade school versus associate programs, junior college programs at one time, many, many years ago, and really couldn't find much of a distinguishment between the two in overall earnings growth. But I have not looked at that for years. And so I can't really give you a good answer for the latest data.
Okay, I'm gonna get Zach going on a question here and then try to monitor this. It's coming in. We've got lots of questions. The first one I'm going to have Zach answer is, did you get essential worker occupations from ACS?
So for the data that I was sharing, yes, that essential worker came from industry and occupation data in ACS. But for our maps that we have on the dashboard, they actually came from LEHD loads data. So that is not ACS. And all of those data sources are listed in the dashboard as well.
All right. The next question up, why was jackknife resampling chosen as opposed to other resampling methods?
So this was really just a subjective decision. I had actually never done jackknife resampling before, but because ACS and IPUMS had recommended using jackknife resampling to do this with the replicate weights, we felt that it was the most appropriate method to go. And since they had guidance on coding, which I did have to modify a bit, but it just ended up making more sense to do that since there was already recommendation for use with ACS data.
All right. I don't know if I clarified at the start. So that's my colleagues at IPUMS USA making that recommendation.
Oh, I will plug IPUMS USA right now. I absolutely love them.
So I was thinking, well, gosh, I wonder if I should be able to answer that better myself. All right, I'm going to do one more to Zach, and then we will finish up. I think it's probably okay if we go a little late. There's a lot of questions here. We'll finish one for David. Zach, the final one, I would be curious to see the comparison of percentage of essential workers by race, ethnicity to that of the total population for the city.
Yeah, I think that this is something that we worked on for the dashboard, and we're obviously it's a continually updating dashboard, and we take community input for what changes get made to it. I actually think we're probably going to try and work this into a manuscript as well, and I think we'll definitely be expanding what we'll be reporting in the manuscript, and that's definitely going to be one of them, because I agree with you.
Great. David, how about, there was one here, how did you calculate the variance?
Here, very simple, nothing extravagant at all. I'm merely looking at the percentage change from year to year. I guess it depends on what variance you're looking at. The percentage change from year to year is all I'm looking at as a gross without adjusting for margins of error, as I indicated before, because the margin of error are going to be so minute for my analysis.
All right. Well, I'm inclined to try to stop on time. There are questions in the Q&A. I think those will live on and perhaps can be addressed in the chat, unless someone wants to. I am not sure if Linda is still with us and has a recommendation, but
if anybody has
that's what I'm going to say for now.
If anybody has any questions for me, in my tab in the speaker resource, attendee resource, my LinkedIn and my Twitter information are there, so feel free to reach out.
And hi, Kathy, it's Linda. I am still with you, and I don't have any other particular suggestions. I would just say that these slides will be available. Dave also has his contact information. So if you had a question and we couldn't get to it, feel free to follow up with either one of these speakers offline.
All right, great. Thank you everyone for lively set of questions, and to our presenters for their work. And enjoy the rest of the conference. I think we're wrapping. I think it's Thursday, and I think we're wrapping up today. That's kind of how my week is going. I hope you all are doing well. Thanks so much.
Okay, thank you.